The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Good morning, folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare. You know, the coronavirus is happening, so Medicare is changing to better deliver services to you. Much more convenient, much safer, too. We're also approaching open enrollment. That's happening pretty quick, and there's some considerations that you need to think about. We'll be talking about those things and so much more, so stay tuned.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid? And how do you decide if you need Medicare Supplemental Insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
Welcome back to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore, and as I mentioned, we're talking about Medicare in the time of the coronavirus. But of course, when we talk about Medicare, we have our experts that come in here, and one of them is Kimmy Everman. Welcome to your show.
Thanks, Brian. It's always fun for me to come and talk about Medicare. Love it.
Oh, it sure is. But you know, we need to get the ground rules or the ground information out. So could you tell us the ABCs of Medicare?
Sure, so we can build a foundation.
Yes.
Okay. So let's, first of all, as you said, there are ABCs to Medicare. Part A, Part B, Part C, Part D.
Yeah.
And it's that sort of, I don't want to call it a jumble because it's not. It's that situation that makes it a little more complicated for folks, because one of the cool things about Medicare is in a lot of respects you can mix and match what you need. Okay, so let's start with A. Part A is your hospital insurance, so, or you may know it as your major medical or your catastrophic. And that's going to go into effect if you have a hospitalization, if you have a car crash, you know, if you have any number of major medical situations that happen. Medicare Part A, for most people, is premium free. And what I mean by that is that for most people, because they've worked many years of their lives and they've put into the pot, so to speak, the Medicare Part A pot, so that comes at no premium. If you were buying that on the open market, and this is actually probably an old number, but you could pay between $500 and $600 a month for that piece of your Medicare. So it is a great, great value.
Yeah.
And how you get that premium free is you work 10 full-time years to contribute to the system. And that just means for whatever half-time here, full-time there, take a year off and maybe have a child, all kinds of different things. You just need accumulation of 10 years, and that will give you Medicare Part A premium free.
And that's as an employee or an employer.
Exactly, exactly. Then Part B is your outpatient medical coverage, and most folks know that you go to the doctor, maybe you have a couple of blood tests done, that sort of thing. That's when you're using your Part B. Part C, we're going to just skip over really quickly, and come back to that. Part D, which I've talked about many, many times at this show, is truly one of my favorites. It's the newest big giant piece of Medicare, and it's prescription drug coverage. Right. And so having that piece along with those other coverages, wow, very, very good value. Then let's go back to Part C for a second. Part C is a kind of a collaboration between A, B, and D. So a company comes together, the Johnson Company, and they sell something called a Medicare Advantage or a Medicare Health Plan. That's what Part C is. And that Medicare Health Plan is got Part A services, Part B services, and for the most part, Part D services as well, all in a package, and then sometimes you even get extra benefits. You might get a little dental, you might get a little vision, you might be able to get a free gym membership, those kinds of things. So those are the 4 pieces of Medicare that you need to, when you start looking to sign up, and then every year after as well, those are the 4 pieces you're always looking at as the puzzle pieces of your Medicare.
And you become eligible at age 65.
That's right.
2 months prior, you're eligible, right?
Actually, 3 months.
3 months, okay.
Yeah, so it's even better. You get 3 months before your birthday month, and 3 months after. And easy to sign up. I can't believe we've gotten all this way into the first segment without me talking about SHIP counselors. Because as soon as I said easy to sign up, I thought of the SHIP counselors. And I just want to right away say to our viewers, that's who you need to help you out with this. If you have any questions or concerns about Medicare, how it's going to work in your life, what you should be looking for when you're making those choices, you call that SHIP counselor, and we're going to put that number on the screen. You can call our toll-free number from anywhere in Montana, and it will roll into your local area agency on aging. And as we know, they have lots of services available there, but they also have SHIP counselors, State Health Insurance Assistance Program, counselors who are there to help you figure your way through the Medicare. And one other thing I'll just add before we reach the end of this segment is that now people's employment is so different. You used to just retire and have Medicare. Now you're working more years, and you may have employer coverage to go along with your Medicare. Even bigger reason you need to call a SHIP counselor to make sure you get that all squared away.
And even if you have employer insurance, you need to sign up with Medicare so that they know that you have that. Right? That's a catch-22.
Exactly. Well, but if you know what to do, you can do it correctly, so you're not paying twice.
Right. And so you're not penalized.
Exactly. And you're not penalized. Exactly.
And for our viewers, we just went over the ABCDs. The C is private sector insurance companies that provide A, B, and D plus additional benefits. But we have the SHIP counselors that'll help you personally. They'll work with you to figure this out. We'll have more information. Stay tuned. We'll be right back.
I've think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Montanans are independent. We're also responsible, protective, and committed to our families and communities. That's why we've done so well against COVID-19. As we open up, we've got to keep doing what we do best. And it starts with each and every one of us, protecting public health in the 406 for our families, friends, and neighbors. We all have to do our part. Montanans get that. And we've got this.
Hi folks, welcome back to Aging Horizons, where this segment we'll be talking about Medicare and the COVID virus. Medicare is changing to help address the Medicare beneficiary needs in this age of the pandemic. And Kimmy, how is Medicare changing to better meet the client's needs?
Well, I think in some ways that I personally find wonderful, not only for our beneficiaries, but for the fact that I'm at the age where these things are very, very advantageous to me. Yes. And I'm only a couple years away from Medicare. I hope it's still there. And it looks like, that's the good news, Brian, is it looks like Medicare is wanting to expand some of the things that they've changed to address COVID. And by expand, I just mean keep it around for a while, especially since we don't know how long things are going to be necessary
COVID
like this.
Active,
And I think one of the biggies that we need to talk about is the telehealth or the virtual medicine that is going on. That has been, I think, a great thing for folks who feel, I just don't want to go out today.
Yes.
I just want to keep myself safe. This is better for me. And frankly, I think the doctor's offices are pretty happy with it as well. They have less people coming in that may be sick.
Yes.
And of course, you can't do everything virtually, but these are a great place to start if something is going on with you. And some of the places where we're seeing this really being used a lot in Medicare, dermatology, psychiatry, cardiology, primary care, gynecology, and endocrinology. Okay, so and what I take that to mean is, because I've done a little bit, a few virtual medicine appointments with my physicians, I would assume that that's a baseline of things where that doctor is gathering information. I mean, obviously a cardiologist cannot diagnose a heart issue over the internet. They're going to have to see you at some point, but this is a way to mitigate all those trips and make it a lot easier on the person emotionally, for sure, to maybe start with this, to maybe do some checkups with this, and just sort of use it as a tool. And so I think it's very, very smart that Medicare has decided that that needs to be, a big part of things.
And so the costs are covered for that.
Right,
yes.
exactly.
Yeah.
Yes, exactly. And, I think, and we're still in the situation where Medicare is covering the cost of COVID testing in some situations. And so I would really encourage people, if you're a Medicare beneficiary and you find yourself needing a test, talk to your physician and find out. And they can help you figure out if you need it, number one. And number two, go call a SHIP counselor and talk with them about it once you've got the information that you need. The thing about the COVID tests, and I mean, I don't want to say any specific number, but what I've read tells me that there is a huge difference between the cost of that test depending on where you might go or what city you're in. And I mean huge as in thousands of dollars difference. So as much as we want people to test and keep safe, be sure that you're keeping yourself safe as you seek that test as well. Don't just sort of show up in one of the lines over at Walgreens. I think you talk to your physician and make sure that that's definitely what you need.
I've heard that there are scammers out there that will call you up and tell you to get a test and send them money, but have your physician recommend it.
Yeah, and I think, nobody is going to be worse for talking to their doctor about this. And it helps reinforce, I just want to give a shout out to everybody with their mask wearing. Well done. And I think it's important to remember that the folks are heroes for doing the mask wearing, in my opinion. That's keeping others safe much more than the mask wearer, and the social distancing. And I'm a hugger and a handshaker from way back, and even I'm learning that a bump on the elbow can still convey the warmth that you want to convey without maybe putting yourself in danger.
This is changing our culture, because I reach out to shake and
and I think people, I find myself wishing those handshaky days were back. And I think it's funny what you miss, because that's certainly something that I miss. But at the end of the day, what you're doing to mask up, wash your hands, all that stuff, you're being a hero. You are helping your neighbors, your family, your friends stay healthy.
And real quickly, Kimmy, that they're doing medicine deliveries now, too, through Medicare.
Yes, indeed. I mean, depending on what Part D plan you buy, you can sign up and have your meds sent through the mail, so you don't even have to drive to the pharmacy. And I did notice the other day, the pharmacy I go to has its own mail program that has nothing to do with a Part D plan. So if you don't see it in your Part D, but you want it, ask your pharmacy. They may very well provide that service, and it's worth an ask.
Or call your plan provider, because bottom line, the providers don't want you sick because they pay for it.
Exactly, that's exactly right. They don't. And let's stay proactive.
Stay proactive. And for our viewers, we have another segment coming up, but we want to emphasize how Medicare is changing in the age of COVID to better meet your needs. So stay tuned. We'll be right back.
$45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
The human heart. Even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. In this segment, we want to talk about the end of the year, end of the Medicare year. We're coming up on open enrollment, which is an opportunity to evaluate the Medicare program that you have and how is it meeting your needs. New programs are coming out. You'll need to evaluate which one would be best for you, and possibly a SHIP counselor could help you out. About mid-September, a couple weeks from now, you should be getting Medicare and You booklet, which explains this year's programs. So, Kimmy, can you tell us more about the open enrollment and how important that is and why we need to be aware of that?
Well, it's so important that it happens annually,
Yes.
number one, October 15th through December 7th, with benefits then starting, your new benefits start then January 1st of 2021.
And you're locked in for the year.
And you're locked in for the year. Well, and let's say with a caveat that there are times that, especially with helping programs, you might not be locked in. And we'll talk about that a little bit later, but I think it's important to remember that whether we have a pandemic, whether we have storms going on, it doesn't matter. The fact remains that October 15th to December 7th, you get a chance to change your Medicare to something, in the event that yours isn't working for you now, you get to change to something else. But it is your time to use your voice to decide what it is that's best for you. And healthcare, let's face it, that's huge. That's a huge part of your life.
And our health is changing too.
Exactly.
Yeah.
So I think, I know for me it's tempting to get distracted by the other stuff. And we don't want to do that here. We want to make sure that you pay attention to your plan and decide which you want for the coming year. And as you were saying before, Brian, perfect time to call a SHIP counselor, especially if you've never done it before. If this is your first sort of annual enrollment, you may want some guidance. And it might be just phone guidance. Maybe you just need someone to sort of talk you through the finer points. Or maybe you have no no internet access or computer access, and you need someone to give you, a hand. Again, that's why a SHIP counselor can step up to the plate for you. So that's a very important thing to remember. And when you're looking at these plans for the next year, you're looking at, okay, here's my health from this past year and the things that I dealt with. Is there anything that has maybe worsened? Has anything new cropped up? Is there anything I'm kind of still dealing with that I will be dealing with, into the future? These are all things you want to look at when you're deciding how your plan should look for Medicare. Also with medication, perhaps the plan you have this year is just not going to be robust enough. Maybe you're on more medications, or maybe what you have is too robust. You're really not on that many medications, and you feel you can streamline a bit.
Yes.
So you go a different way. And that's how the SHIP counselor can help you figure your way through that maze.
And you know, what's good with the SHIP counselor is that they have access to all the area agency on aging programs,
Right.
and they can find out if you're eligible for other programs, much like the helping programs, which again is in
Exactly.
the Medicare arena. Tell us about the Medicare.
Well, the helping
programs.
programs, I'm glad you asked, Brian, because they are just very, very significant for folks. There's a number that we have. One is called MSP, or Medicare Savings Program. The Medicare Savings Program helps a person pay their Medicare Part B premiums and other costs associated with Part B. We have low income subsidy, or LIS. That's also known as extra help, and that is a helping program for the Part D, or the drug piece of Medicare. And it can help with premium costs and other out-of-pocket costs. We also have Big Sky RX. I never want to forget that. That is a Montana program, homegrown, for folks who are on Medicare Part D and need a little assistance with the premium being paid each month. And what's wonderful about Big Sky RX is they're not as stringent about what you have. So you have a higher income level that's going to make you eligible than you might have had before. Other programs, and also they don't care about your assets.
Right.
So these are, and again, you know, I went through those quickly. We don't expect our viewers to just get it. We want you to call that SHIP counselor, because he or she can help you with not only how to navigate, but all the helping programs that are out there. And we want folks to explore those helping programs. We don't want people not having heat, not eating food, not taking their medicine because they don't have enough money. Reach out and maybe we can find something to give you a hand.
We can help you out. Another point, you know, we're drawn to the close of the year. If you need medical services like your dental checkups, your eye, your hearing, make the appointment now, because they book in November, December, and you can't access those.
Yes, and I think it's important to also remember that, again, in the age of COVID, they may be only having half as many appointments available because of social distancing and that sort of thing. And so it's even more important to sign up soon and quickly.
So make those appointments. Talk to your SHIP counselor.
Yes, indeed.
Well, Kimmy, we've drawn to the close on another great show so quickly, and there's so much we could keep talking about. We want the people to call the SHIP counselors. That's so important in that they don't have anything on the shelf to sell, nothing to promote, but your best interests.
Exactly, and they live in your community, and they are aware of the surroundings that you're aware of. It's like someone that's a neighbor.
And it's all confidential. And for our viewers, keep tuning in every Sunday at 10:30. In Billings, we have another time. But for Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.